Hey guys, April Lopez coming to you live from Lopez Family and Wound Healing Center. Pardon me. I just came back from doing a wound care house call. There has been a great need for increased wound care, especially for homebound patients. I know home healths have called and asked. We used to do house calls in the homes, clearly visits in the homes for patients that could not get out of the house, did not have transport, and we couldn't do them anymore because of COVID, okay? We service from Brownsville all the way up to La Jolla. But, you know, COVID happened and things got busy. And so now we're finding that a lot of patients are really deteriorating in the home because they're afraid to come out and they're afraid to go to a wound specialist's office, or they're afraid to get out of the house, or they just don't have transport. So we will be doing house calls again. That's why we're redoing our wound care in-services for the home healths. So you guys see kind of what we use, and to kind of meet the new nurses. We write a lot of home health because all of our wound patients need wound care in the home. The family can always be taught. We do believe in teaching families and then seeing the patient once a week. We understand that not all the nurses can be out there every day. That's fine. So we do believe in that. We also help these patients learn as they come. We see them every week. And for those that are homebound, we can go see them in the home. So to answer your questions, yes, we are starting our wound care in services again, because we feel like the wound care area is really, we're taking care of so many COVID patients, and we're going to continue to do that. But we're going to open up another day for our house calls again, for our house calls program, because we understand there's a great need. There's a huge need in the Brownsville area. We have great doctors in that side that do revascularizations, and they have a lot of wounds, and nobody can do any house calls for these patients. So we will be servicing the Brownsville area again for house calls. For those of you that have called and texted and asked, yes, we're going to be doing that again. We will be having a dinner with a wound care in-service in the Brownsville area on October 28th at 7 p.m. So if you're a wound care nurse, or just a nurse in general, any home health nurses that see patients in the homes, and you want to get refreshed on your wound care skills, today we're going to be covering one topic. So that's throwing that out there, guys, for all of you that have been asking. Yes, we're going to be doing that. Yes, we're going to be doing house calls also in the McAllen area. We just came back from one of our house calls, and man, I'm going to tell you, that patient felt so much better, right, sweetheart? After we did your wound care, after we took care of you and helped your mom out. So it takes a special group of people to do what we're doing. We're going to continue to service you via telemedicine for COVID, yes, but we are going to, again, pick up where we left off for a house calls wound care program, okay? So if you need information, if you need an appointment, log into the telemed. If you need information, inbox. So today, what are we covering? So that's to answer the question, so I don't have to text everybody back. What are we covering today for wound healing? Guys, remember, wound healing, prevention, that was the first week. Next thing is, si se puede, yes we can heal your wound. No, we don't have to cut your toe off right now. We don't have to cut your leg off right now. Give me a little bit of time, okay? One thing that I wanna talk about today. If the wound is wet, please don't wet it. I say this respectfully. I'm just gonna take a sip of my Americano with a little bit of pumpkin cold cream. Guys, if your wound is wet, I know they're well-meaning nurses. I'm a nurse. I've been doing wound care for 24 years. Now I'm board certified in wound care. I'm in advanced practice. I can prescribe the treatments. We know better. Help out our colleagues. Help out our doctors. They do not get trained for wound care in the medical program. That's why there's not a lot of wound care specialists. That's why we don't have as good of outcomes in wounds, because we've been doing wound care from day one, right? It was my very first type of patient in my clinicals back when I was literally a teenager. So we literally have to help our doctors, tell them what's not working. Doc, this is not working. This wound is wet. We can't wet it. Please don't wet a wet wound. You got to dry that wound out. There's a lot of very good powders. There's a powder that I use. Everybody calls it the magic powder. It's an oldie but goodie. No, it's not sulfatiazole. We're going to talk about that in the wound care conference for my colleagues, my nurses, my fellow nurses. So if a wound is wet, don't put ointments on it. You need to put a dressing that will draw moisture from the wound, depending of where the moisture is coming from. If it's in an area of the coccyx, consider a wound vac. A gluteal area, a large area in the leg. Any large wounds, consider a negative pressure dressing, a wound vacuum. Why? It seals it. If it's an area where there's diarrhea, protect the wound. Dry out the wound if there's a lot of water. Please stop writing Silvadene for all the wounds. Silvadene is not for wounds. Silvadene is for burns. Okay, there's different types of burns. Silvadene is for burns. It is not for wounds. Hydrogel, wet to dry, is not for a wet wound that's oozing a lot of liquid. Okay, let's look to see where the liquid is coming from. This patient's urinating on themselves. What can we do to get the urine away from that area? Okay, so that is the takeaway for today's video. I'm not going to spend all day telling you a lot of stuff that's going to bore you. If the wound is wet, you got to dry it. Find a good powder. If your practitioner's not writing a powder for you, if you have a wet wound, seek a second opinion. Don't let them put an ointment on a watery wound. Okay? Moist wound healing is a principle of wound healing. It doesn't mean wet water oozing always. I'm going to add more water. This is a very simple step, because guys, if you as a patient, as a family member can say, doctor, the wound's wet, why are we putting more ointment? They're going to see that, okay, well, maybe this isn't working. So help them out. You know, nurses, we are the eyes and ears for the doctors. When I was a floor nurse, when I was a home health nurse, I was like, this isn't working. Let's change it. And let's change it. How do you know something's working? You see improvement every week. You don't see improvement, we got to change that care. Just like I tell you guys, COVID, I call you guys. You know, I call you every day. I see you via telemed every day. Your telemed isn't working, I call you. Are you better, the same, or worse than yesterday? That's my favorite saying. Are you better, the same, or worse than the last time I saw you? Is your wound better, the same, or worse than the last time I saw you? If your wound is not better, I need to change it. Or if I see some granulation, I'm going to run with it. Okay? So don't self-treat. Seek a second opinion. Go back to your doctor, your practitioner. This isn't working. Inbox if you have questions. Nurses, fellow colleagues, inbox if you have questions. We're in this together. We want patients to heal. Stop amputations. And we're going to see you next time. Bye, guys.